Hi, it's Jeremy Hawke from Hip2Toe Podiatry. I'm a podiatrist and I'm going to talk to you today about athlete's foot, or what's often known as Tinea pedis. Athlete's foot can present itself in the feet either on the skin or the nails, and the symptoms are redness, burning, itching and scaling of the skin. And fungus normally grows, in order to allow itself to grow, it needs a warm, dark, moist environment, and a shoe is a perfect environment for fungal growth. It's very important to treat fungal infections of the skin and nails as quickly as possible because of the added risk, especially when skin may blister or may actually fissure, where you get a break in the skin. It's very important to prevent this from taking place because it may lead to infection. Now, an example of this would be if you were to get tinea between the toes and the skin were to crack. That crack may allow a portal of entry for a bacterial infection. That bacterial infection may be a localized infection first, but what can take place after that localized infection is an infection of the surrounding tissues, where you get sheaths of tissue, where you get infection taking place between those sheaths of tissue, and you get a condition named cellulitis. And cellulitis, of course, can become septic and actually affect the whole body, where you get sepsis taking place. So if you do get signs of any itching or burning or scaling between the toes or on the bottom of the feet, very often in the arch area of athletes and dancers, you'll get a fungal infection, or you may see it in the nails. It's really time to have that checked out by your health professional. As a podiatrist, this is something that I see on a regular basis, and very often you can use an antifungal which can be topically applied to fungus that affects the skin, and there are also topical applications of fungal treatments that can go on nails, although sometimes there's a requirement for oral antifungals depending on the severity of the infection. So if you feel you need any fungal infections of the skin of the feet or the nails to be examined, please come and see me at Hip2Toe Podiatry, and we'll arrange a full assessment and diagnosis of the problem that you have. And remember that fungal infections can be passed from one person to another, so if there's somebody in the family that does have a fungal infection, it's a good idea for them to wear thongs in the shower. And also, to prevent fungal infections from taking place, cotton socks are probably the best type of socks to be wearing, and also making sure that you dry between your toes properly after showers, and use powders where required to allow extra dryness. This is Jeremy Hawke from Hip2Toe Podiatry. Have a wonderful day, and thank you for joining me.